So you're probably wondering how we got here. A few months ago, Democrats in the House and Senate both barely passed their own versions of a government healthcare takeover bill. Neither chamber wanted to take up the other's bill, and it was unclear how things would move forward. To make things more complicated for Democrats, Scott Brown wins his election to the Senate, and with it takes away the Democrats' filibuster-proof majority. After much arm-twisting, deal-making, and a meeting at the Blair House, the Democrats decided that without a filibuster-proof majority in the Senate had no chance of passing the House bill. The only way to move forward would be for the House to pass the Senate bill. So they would vote on the Senate bill in the House, and then have the House and Senate pass a package of amendments, changes, and deals under a process called reconciliation, which only requires a simple majority instead of the usual 60 votes in the Senate. There was just one problem. The House has to pass the Senate bill before reconciliation fixes can be attached. But they don't want to do that because of all the sweetheart deals included in the Senate bill, like the Cornhusker kickback, the Louisiana Purchase, and of course Gatorade. The Senate bill was a political football that no Democrat wanted to catch. So the Democrats needed to find a way to vote for the bill while telling people they didn't vote for the bill. Genius. But that's not how it's supposed to work. I've seen Schoolhouse Rock. Well, here's the plan. On every bill that comes to the House floor, there must first be a rule that is passed by a recorded vote. The rule governs how lawmakers will handle the legislation on the floor. In other words, the rule establishes how much time is available for debate and what amendments are allowed. What the Democrats are going to do is, within the text of the rule, include a self-executing rule, or a deem and pass clause, which would mean that when the House passes the rule for the reconciliation package, it would simultaneously deem the Senate version of the health bill passed as well. The Senate bill would get sent to the President, the House would then go on to vote for the reconciliation package and send that to the Senate. The Senate would pass the package with a mere 51 votes, and the package would be sent to the President. Then, your taxes go up, Grandma loses her current Medicare plan, your boss's taxes keep going up, and he takes it out on you. Some guy in a marble building in a blue suit tells you that you have to buy approved health insurance and you have to buy coverage for acupuncture even though you've never been to China. But don't worry, we'll continue to borrow from them in order to pay for it. See, who said procedure could be boring?